Hi, I'm Mike Hellams, and I specialize in family medicine. I'm from Fountain Inn, South Carolina, and I'll be practicing in Fountain Inn, South Carolina. And I'm a South Carolina product from first grade all the way through residency. I went to Hillcrest High School, I went to the Citadel, and then for medical school I went to the University of South Carolina and did my residency in Spartanburg. So I'm kind of a hometown boy. I think it's one of the most interesting specialties because we get to treat everyone. We're there from cradle to grave and everything in between. And we're usually the gateway to diagnosis and starting treatment of whatever problem you have. And then we're kind of the traffic cops that get you to the right specialty if you need one. So you'll spend more time with us than any other medical specialty, most likely. The idea of taking care of people at their home, even sometimes in their home, and being there for all the big milestones of their lives, and sharing the joys and the sorrows that they go through in their life, and hopefully reducing their suffering and shepherding them through to the end of their life with dignity, and someone that's a constant in their life. A lot of people that get with a primary care doctor and stay with that doctor through their entire career or their entire lives, and that appealed to me. And just being a small town South Carolina boy, that appealed to me as well. I look at it as a teamwork. It's no longer a doctor dictating to a patient what they should do, what they should take, how they should act. It's a collaboration, and you're more likely to get a patient to do the right things for their health if they not only are the patient, but they have a stake in it, and they have a stake in that decision making, and they understand why you're doing things. You don't just throw a prescription at them. You explain why you're doing that, what it's going to do for them, short term and long term, and make it a collaborative effort with your patients, so they get to participate in it and they get to be the decision maker. When I'm not at work, I usually don't do things that are involved in medicine at all. I have a hobby farm that I enjoy riding around on my tractor and doing things like that. I restore antique cars and have a collection of antique automobiles, all those muscle cars all of us kids in the 60s wanted but couldn't afford. And I also enjoy outdoors, skeet shooting, camping, things like that. To schedule an appointment with me, please use the contact information on my profile page.